Hi, folks. I'm going to talk about how to enter enhanced long-term additional follow-up in the QC's OBERD system. This process is critical to our long-term follow-up efforts and also to post-market surveillance requests we have to follow certain types of meshes and other products. So it's important we get this right and as consistent as possible across the QC. So you can see here, this is a test version of the QC with some fake patients here, and this is a typical patient list. I'm going to scroll down to this patient here, Jane Doe, and we're going to open up Jane Doe's forms. And you can see the preoperative information and the operative details have all been filled out. The 30-day follow-up has been filled out. And now I'm going to go down to these additional forms, which will alternate between PROs and also additional follow-up. We're going to focus on the additional follow-up, which is the clinical follow-up that we're interested in entering in terms of this video. Entering long-term additional follow-up is really a two-step process. The first process is assessing whether a patient has had a reoperation for recurrence and entering that information. And then the second step is really looking up any other clinical information in terms of recurrence or wound events or other things that might have occurred long term. So you're going to have to open up your electronic medical record while you're entering this information so you can enter information from the electronic medical record into the OBER system here. So here, I'm going to look at the time window that's most appropriate to our date of entry, and today is November 23rd, 2024. And so this time window, although it's slightly off, is the closest one to this date of entry. In the real version, you'll note that there's going to be no gaps here, so you'll be able to find the exact time window that when you enter information, whatever date you're entering it on, you'll find a corresponding time window. You want to find that corresponding time window, and then go ahead and open up this little drop-down menu here under Actions and click Answer. So here we're going to select that the patient missed the time window of data entry, and then click Next. So our data follow-up is today. Procedure type the patient underwent was a ventral hernia repair. This is data obtained from medical record or abstraction. And then here is the first kind of step here. We're going to look and see if the patient has had any hernia recurrence information in this time window. There's two ways of obtaining that information. The first is if there is a clinical exam performed by any credentialed medical provider that covers the area of interest. For example, here in the ventral hernia operation that was done previously, if there's a documented abdominal exam that doesn't note any recurrent hernia, you can click that clinical follow-up was entered. If there was a CT scan performed, say the patient had a cancer operation in the past and undergoes surveillance for that after the hernia surgery, hernia operation, you can click radiographic assessment if it falls in this time window, that is, and then click that the patient had a CT assessment. We can enter that information as well, and then click Next. And then if there was a recurrence on those, you could click Yes. Otherwise, you just click No. Go to the next form. And then here, this is one of the components is entering whether or not there was a reoperation for any reason, including recurrence. And if the answer was no, you click No. I should go back for 1 second regarding reoperation. You can pretty much always determine if a patient has undergone a reoperation for recurrence. The best way I can instruct you to do this is say you're in clinic and you're trying to determine if a patient has had an operation over the past couple of years. You look to the usual things. You look in operative reports and procedures. Sometimes you look in the media tab, or you can even look in Care Everywhere. So you can pretty much always determine if the patient had a reoperation for recurrence. And this should pretty much be available on everyone. And the expectation is we have an entry for reoperation for recurrence on every patient we perform the long-term enhanced additional follow-up for. Now, contrast that with recurrence itself or any of the wound events. If there is no abdominal exam or any imaging, you may not know this information, so you can skip it. So again, reoperation for recurrence, you'll pretty much always be able to enter a yes or a no. Most commonly, it would be a no. For recurrence, that's only entered if you have information in that time window regarding a radiographic study or a physical exam. And then same thing with surgical site infections or incurrences. Most oftentimes, the answer will be no if there is a documented physical exam or radiographic study that covers the area in question. If that's the case, we'll click no. If there is no assessment, then we just leave both of those blank, but we'll say that the CT scan and physical exam were identified in EMR, so we click no for that. And if the patient had any other long-term complications that we can determine yes or no, we can assess that as well. And then we finish the form with finally the opioid use questions. This may be difficult to determine in the long-term follow-up. Most oftentimes in long-term follow-up, these are no, but if you can't determine this, you can certainly leave these blank. And then that should complete the long-term assessment. So just to summarize, there's really two key pieces of information for assessing long-term follow-up or additional follow-up. The first is reoperation for recurrence, which we can almost always obtain from the EMR. So that should be obtained on pretty much every person. And then the second piece of that is whether or not a recurrence has occurred or any wound events. And that you can only enter if there is a documented negative physical exam or positive physical exam or a radiographic study corresponding to the area of where the hernia was performed. And I should also note one of the key steps here is to make sure that you are entering the additional follow-up in the correct time window corresponding to either the date of today's date, which will be the date for reoperation for recurrence, or you can select a different time window if you have radiographic or physical exam information at an earlier date that corresponds to the time window. Thank you.